Hey everyone, you have found the lower limb video. And in this particular video, what I'll do is I'll describe the bones we find in the lower limb skeleton. So what I'll do is I'll start off with an overview of the bones. What are the bones that we find in this lower limb skeleton? I'll describe a few key landmarks for each bone and how the bones connect to one another. And then at the end, I'll provide a little practice quiz to help you embed this information into your brain. So on this slide, far left, I have the femur, the bone of the thigh, connecting to the tibia and the fibula, the two bones of the leg. In the image of the center there, we see the pelvis connected to the head of the femur. And then far right, I have the femur, the posterior view of the femur, pictured there, the bone of the thigh. On this slide, we have the tibia on the left. That is the medial bone of the leg. And on the right is the fibula, the lateral bone of the leg. And then on this slide, we have the tarsal bones, far left, metatarsals, and then far right are the phalanges, the bones of the toes or the digits. So let's go ahead and start with the pelvis, and then what we'll do is we'll talk about the bones from proximal to distal. So this is where the lower limb is anchored to the axial skeleton. So if you remember the upper limb has the pectoral girdle, the scapula, and the clavicle that anchor the remaining bones of the upper limb to the axial skeleton. The hip is doing that for the lower limb. So, and also know that the pelvis itself is composed of three bones that are joined together. Another way of saying that is they're fused together. So these three bones are called the ilium, the ischium, and the pubis. And so what's pictured in the image to the right also is the pelvis as it's connecting to the head of the femur. And the femur, again, is the bone of the thigh. So those are the three bones there, as indicated by the three colored triangles. So we have, indicated by the blue triangle, that is the ilium. And then we have the pubis, as shown by the red triangle. And then lastly, the green triangle is showing the bone called ischium. So these three bones are fused together to form the pelvis, which is the hip. So this is a picture, an image showing the lateral aspect of the pelvis, and it's a good view of a structure called the acetabulum. So the hip joint is a ball and socket joint. The socket is actually created by this acetabulum, and then the head of the femur, which is the ball for the ball and socket joint, connects to this acetabulum. So then let's move our way distally for the lower limb. So the femur is the bone of the thigh. The proximal attachment is the pelvis at the acetabulum. I'll just leave that in. We're all humans here, which is the lateral socket for the ball and socket joint. And then distally, the attachments are the tibia and the patella. So the tibia is the medial bone of the leg, and the patella is the kneecap. So note that the fibula is not there. The fibula basically just connects to a smooth aspect on the lateral part of the tibia. So a few key landmarks to note here for the femur. We have, as indicated by the blue arrow, we have the head, and so this is a medially directed structure that connects with the acetabulum and forms that hip joint. Then we also have, as another set of important landmarks here, we have the condyles. These condyles are important because they make a connection to the tibia. So we have a medial condyle and we have a lateral condyle. The medial is indicated by the red arrow there, and so note it's on the same side as the head of the femur, so that's a good way of knowing that's the medial condyle. And then the green arrow shows the lateral condyle. So here's a posterior view of the condyle, so you can see that these are smooth portions of the femur, and they allow the bone to make a really good connection with the proximal part of the tibia. So the joint we're creating here by this connection is the knee joint. So as we work our way distally now, we encounter the tibia. This is the medial bone of the leg. So the leg is between the knee and the ankle, essentially. So the proximal attachment is the femur. Then the distal attachment is basically creating the ankle joint. And we make a connection at the talus, which is the most superior, i.e. proximal bone of the tarsals. And then the lateral attachment is the fibula. There's a smooth surface on the lateral part of the tibia that allows for the fibula to make a connection. So we have a couple important landmarks to focus in on here on the tibia, and one is the medial malleolus, the other are the tibial condyles. So what's pictured here by the red arrow is the medial malleolus. So this is the distal aspect of the tibia, and you can feel this on yourselves, either inside your shoe or if you have your shoe off, it's on the medial aspect of the ankle. And it's basically the bulge or the ball that's on the medial aspect of your ankle. That is the distal aspect of the tibia on the medial side. Then we have the tibial condyles. Those are pictured in the image on the left. And so we have a medial and lateral condyles. These are basically just smooth surfaces to allow for the femoral condyles, medial and lateral, to make a connection to the tibia. So basically we're creating the knee joint with this connection. And then on the right, with the blue arrow, that's another view of the medial malleolus. Fibula, the lateral bone of the leg. So proximally, it attaches to the tibia, to the lateral part of the tibia. Again, there's a smooth surface on the lateral tibia to allow for the fibula to make a connection. And then distally, it anchors the lateral part of the primary ankle joint at the talus. So we have a head of the fibula and a lateral malleolus, among other landmarks, but these are the two key landmarks I'd like to highlight for you. The head is the proximal block-like or blocky portion that makes a connection to the tibia. And then the lateral malleolus is the distal flatter portion and basically flanks the lateral aspect of the primary ankle joint. And so that's indicated there by the red arrow. So on the left on this slide, on the left image, we have the head, which is the blockier aspect of the fibula, the proximal aspect that makes a connection with the tibia. And then you'll note on the right that that's a flatter looking structure, and that's actually the lateral malleolus on the right there, the distal aspect of the fibula. So then we have the ankle and the foot composed of the following. We have tarsals, indicated by the red circle. We have metatarsals as we move distally by the blue arrow, and then most distally for the entire lower limb are the phalanges, as indicated by the red arrow there. So the ankle joint, the primary ankle joint, is created by the attachments you can see in the picture on the right. So the tibia and the fibula, as indicated by tib and the F there, are connecting to the superior or proximal aspect of the talus. So the fibula is anchoring the lateral side, and then the tibia is anchoring superior and medial side to create the ankle joint. So this is the junction of the foot, of the ankle with the tarsal bones. So two key tarsals I'd like to highlight at this point. We have talus, which connects to the tibia and the fibula, and then we have calcaneus, which is the heel bone. So the calcaneus receives the Achilles tendon, and another name for the Achilles tendon is the calcaneal tendon. So ultimately our calf muscles attach onto the calcaneus. And so if you go to the gym later tonight, you do calf raises, those muscles attach to this calcaneal tendon and allow you to plantar flex. So that's the terminal attachment site for that group of muscles there. All right, so what I'll do is we have some numbers on particular bones, and I'd like you to try to remember some of the key landmarks that I highlighted in the previous slides. And so feel free to pause as I come to each slide to give you a chance to think what bone is what there, and then I'll provide the detail for the labels that I have. So take a minute here, either pause or I'll just pause for a second. And what are the bones of 1 and 2? So if you said number 1 is the tibia, you're correct. And the structural landmarks that I highlighted were the medial and lateral condyles, the proximal aspect there. And I showed you a picture of that earlier in the video. And then also the medial malleolus is the distal medial aspect of the tibia. Number 2, if you said fibula, you're correct. And I highlighted for that bone the blockier head, which is the proximal aspect of the fibula. and then the distal lateral malleolus. So again, feel free to pause me at this point and try to answer all of these. But as we go forward after that awkward pause here, we can say number 3 is the femur connected to the tibia and the fibula. In the central image there, we have the pelvis connected to the head of the femur. And so that lateral structure at the pelvis is the acetabulum. And remember, the pelvis is composed of ilium, ischium, and pubis. And so the femur then is far right. That's number 5. You're seeing the posterior aspect of the femur, and you're also seeing distally the medial and lateral condyles, and then proximally, so that would be the top of the image, you're seeing the head of the femur, and remember that's always pointed medially. And then lastly, again, pause me if you want to, but let's take a look at red arrow, blue arrow, and green arrow. So the red arrow would be the tarsal bones, and I highlighted the most superior or proximal tarsal bone as talus, and then immediately, actually above the arrow, is the calcaneus, another tarsal bone. But remember, we have 7 tarsal bones in total. And then a blue arrow is showing us the metatarsals, and then lastly, the green is showing us the phalanges. So what we did is we talked about the bones that we find in the lower limb skeleton. So we talked about the pelvis, i.e. the hip, the bone of the thigh, which is the femur, so that's between hip and knee. Then tibia, fibula, bones of the leg, so that's between basically knee and ankle foot. And then lastly, the ankle foot, composed of tarsal bones, metatarsals, and phalanges. And so what I'll do is in the next video, I'll talk about the bones that we find in the axial skeleton. So those are bones like the skull, vertebral column, etc. And so, of course, I haven't talked about all the landmark structures you'll see in the lower limb in this particular video. So if you want more help, more labels, some quizzes, etc., feel free to head over to anatomyonthego.com and you'll find some of those resources there. Otherwise, I will see you in the next video. Take care.